Good afternoon, Madam Chair, member of the committee. And I know we're anticipating other members to join us, but they say timing is everything. And so one of the first things I wanted to do is sort of clarify that not despite, but in addition to the actions taken by conference committee yesterday recommending to both houses that a tobacco tax increase be part of our budget solutions over the next several weeks, I nonetheless felt it important for this bill, SB 600, to continue to move forward in the process. So let me give the background as to why I believe this bill is important and timely and needed, not just for budgetary purposes. The story begins in 1988 when California voters approved Proposition 99, which placed a 25-cent tax on tobacco. 10 years later, California voters again approved a tobacco tax, this time increasing that tobacco tax another 50 cents. The portion of the revenues that have been derived from both of those tax increases have established and funded California's tobacco control programs, which have not only served as a model for other states and the rest of the nation, but have contributed in large part to California enjoying one of the lowest smoking rates in the nation. Unfortunately, we still have a high smoking rate. 4 million people in our state smoke, resulting in over 40,000 deaths per year. So we've significantly reduced the smoking rates, but we still continue to see 40,000 deaths a year attributed to smoking and its health consequences. 10 years ago, I was first elected to office on the Los Angeles City Council. And I'm not introducing this bill as a way to increase taxes to celebrate 10 years in office. But in the last 10 years, California has stood still. We have not increased our tobacco tax in those 10 years. So what's happened in those 10 years? 46 other states have increased their tobacco taxes, a total of 93 times, including, most recently, the states of Florida and Mississippi. California now ranks 32nd in the nation in the level of our tobacco tax. This $1.50 increase wouldn't make us number one, but at least it would get us back in the top 5. I've introduced this measure because increasing the price of cigarettes is a proven effective way to reduce smoking, particularly amongst young people. That's what we're trying to do. And Senator Steinberg put it well at a press conference a couple of months ago when we unveiled a package of bills related to tobacco. He said that even if this measure didn't provide a single dime for the general fund, it would be worth it because we can reduce teen smoking. Today, 36,000 young people become smokers in California every year. And we know from adult smokers, particularly heavy smokers, that 3 out of 4 of them began to smoke when they were minors. So with the 36,000 young people that pick up the habit every year, I believe we still have a tremendous responsibility to build on the success that we've enjoyed over the last several decades, but do more to keep kids from smoking in the first place. This bill, SB 600, will increase the state's excise tax on cigarettes by $1.50 per pack. And while the bill as written would direct 85% of the revenues to the general fund, where a large chunk of those would go to our health infrastructure in the state, 15% would be set aside to fund tobacco prevention efforts, smoking cessation programs, lung cancer research in a significant way, and towards the enforcement of our tobacco laws, specifically the laws as they pertain to sales to minors. In doing so, I think SB 600 will have a tremendous impact on a comprehensive basis towards improving the health of Californians. I want to introduce a couple of folks who are here today to testify in support. Ms. Grace White, a volunteer with the American Lung Association and Dr. Diane Parker Carr on a timely basis. Dr. Diane Sobkowitz representing the American Heart Association, also those two organizations being bill sponsors.
Thank you very much. And as you can see, we are getting more members. I understand the Republicans are just finishing up their caucus, so they will be here shortly. On witnesses, we welcome you, and it is, pardon me? We need 6, right? 6. We need 2 more. We're operating as a subcommittee right now. Thank you. 2 witnesses, 3 minutes each, and then everyone else just to state your name and that you are in support. Whoever would be the 2.
Good afternoon, everyone. I'm very happy to be here. In fact, since I'm a lung cancer survivor, I'm happy to be anywhere. My name is Grace White, and I have lung cancer. I was diagnosed approximately 19 months, 2 weeks, and 3 days ago. I live in Colfax, California, which is in the center of the universe, right there off of Highway 80. I worked as a stand-up comedian for years before I was diagnosed, so I traveled all over and saw smoking everywhere. I am a constituent of Senator Anistad, and before I was diagnosed, actually, when I was diagnosed, my doctor told me I had 3 months to live. Well, it's 19 months later, and I'm still here. And I'm fighting hard to advocate and reduce the burden of tobacco and to get better screening and treatment for people with lung cancer. Had I had better, if there had been screening, it would have been caught before it was stage 4 with me. So the screening is practically non-existent, so it's very important. Lung cancer is the leading cause of cancer deaths in men and in women. 25% of lung cancer patients that are women never smoked. 15% of the men that have lung cancer never smoked. I never smoked, but that really doesn't matter. We need to do more, and the time is now. We need to support Senate Bill 600 to help us prevent more kids from starting to smoke and help smokers to quit and reduce lung cancer in our state. We need Senate Bill 600 to help us battle the multi-million-dollar marketing crusade by the cigarette companies that tell children that smoking is sexy and that it makes them look sophisticated and cool. Senate Bill 600 will help us battle the lies that lead to lung cancer and other terrible diseases. Isn't it about time that California passes a tax that helps protect kids and that does more to fight lung cancer? Thank you very much.
Thank you very much, and you are in our thoughts.
Madam Chair, members, I'm Diane Sobkowitz. I'm a cardiologist and volunteer with the American Heart Association for over 15 years. And as I've been here before, and we've talked about heart disease being the #1 killer of men and women in the United States. And if you think how long we've been in this room since I parked my car, for every 37 seconds, you have 1 death of heart disease. So that's something for us to think about. And tobacco is the #1 preventable risk factor for men and women. And we've been very successful at preventing deaths for heart disease, except for one group, and that's women between the ages of 44 and 55. And those women, again, the #1 modifiable risk factor is smoking or tobacco use. And women are twice as likely to have increased risk from smoking than their male counterparts of the same age. So in my practice, just the other day, a couple days ago, I saw a patient that I've been seeing for years. I see her family. She's in her 60s. Ruth, very sweet lady, had bypass a couple years ago. And she smokes. She smokes a pack a day. And this woman can't afford much, but she has the habit that she's had for over 50 years. And she actually told me, she says, well, I've heard the cost of a pack of cigarettes is going up, I'm going to have to stop smoking. So the bypass surgery wasn't a deterrent, it's the cost of cigarettes. And she has a daughter who I see in her 40s who has asthma, congestive heart failure, on oxygen, and she says, well, what can I do for my daughter as well? So again, that kind of brought light to me that, wow, this is going to make an impact on people. So tobacco use costs the state, and I don't have to tell you this, over $8 billion in health-related costs. And so what we're looking at is the passage of $1.50 for the tobacco tax will result in the 5-year health savings of $65 million, and of course, fewer smoke-related deaths. So increasing California's excise tax and allocating the money for tobacco control and prevention is a sound investment, in my opinion, to save these lives, to save my patients, and to prevent further risks. There's only so much we can do at medicine, but we need to do more for these people. So I appreciate your vote on this and urge you to support this.
Thank you very much.
Thank
If
you.
others in support would just state their name and that they are in support.
Thank you, Madam Chair and members.
And others can come up if they're in support. I can see a lot of people who would like to testify.
Teresa Stark with the California Medical Association in strong support.
Jim Knox, American Cancer Society, which is a proud co-sponsor of the bill. We urge your support.
Thank you.
Jai Suprasad with the California School Employees Association in support.
Thank you.
Terry Calgar-Hill on behalf of the 100% campaign in Pico, California in strong support.
Thank you.
Tim Madden, representing the California chapter of the American College of Emergency Physicians, as well as the California chapter of the American College of Cardiology in support.
Deborah Matos in strong support for the Bonnie J. Adario Lung Cancer Foundation.
Carrie Gordon, California Dental Association in support.
Thank you.
Nicole Wortelman, Alameda County Board of Supervisors in support.
Thank you.
Robert Harris on behalf of the California Society of Addiction Medicine in support.
Mary Hernandez with the California State Council of Service Employees in strong support.
Thank you.
Pamela Gibbs for the Los Angeles County Superintendent of Schools in strong support.
Brendan Tuig on behalf of the California Center for Public Health Advocacy in support.
Thank you.
Gloria Hufty from Lung Cancer Alliance in strong support.
Joanne Granzella, Lung Cancer Alliance in strong support.
Andy Katz from Breathe, California in strong support.
Thank you.
Judith Michaels, California Federation of Teachers in support.
Thank you.
David Vandergrift from the California Hospital Association in support.
Thank you. Is that everyone who's in support? All right. The opposition, please. 2 witnesses, 3 minutes each, and the rest just to state their name and position. Welcome.
Good afternoon, Madam Chair, members of the committee. Michelle Peelsticker, California Taxpayers Association. We're in strong opposition to this bill for a variety of reasons. First, the state just enacted $12 billion in tax increases, and the voters declined to extend those tax increases in the May election, sending a strong message that more tax increases are not the preferred approach to balancing the budget. Moreover, the tax on cigarettes would be a regressive tax, targeting those with lower incomes that tend to have the highest smoking rates. Second, the dual purposes of the bill to reduce smoking and produce general fund revenue to reduce the deficit will not be fully achieved by this bill and will produce unintended consequences. And I will say that I can appreciate the adverse health effects of smoking. I, too, am a throat cancer survivor, so one can be a cancer survivor and also be opposed to a tax on cigarettes. The bill allots 85% of the revenue generated from the tax to the general fund. It is known that cigarette tax revenue is a declining revenue source. Senator Chief Cheney acknowledged such in the conference committee. If the goal of smoking reduction is achieved, then the tax revenue that flows from the additional tax will decline with the smoking rates, leaving the general fund with an out-year hole. Cigarette tax revenue also is a declining revenue source due to black market sales of cigarettes that increase when the tax goes up. Sources of low or no tax cigarettes are military bases, Indian reservations, other states, and foreign nations, such as China and Mexico, all of whom are filled with vendors that sell cigarettes over the Internet. Internet sales allow the bargain shopping smoker to order their cigarettes at a lower price from elsewhere and avoid California tax, despite the practice's illegality. Although the BOE has reported some success in its enforcement efforts against cigarette smuggling, it nonetheless indicates in its analysis that it believes that the proposed cigarette tax increase and resulting increase in the other tobacco products tax could result in an increase in cigarette and tobacco products tax evasion. Finally, the social costs resulting from increased black market activity are not worth the additional tax revenue gained. Smugglers stand to make a profit of hundreds of thousands of dollars for every tractor-trailer load of black market cigarettes sold. When there is that kind of money involved, we also see an increase in other crimes, such as robberies, hijackings, and even murder. Our local public safety officers already are understaffed and overworked, and this bill would only add to that burden. So for these reasons, we are opposed to SB 600.
Before we continue, Senator Leno has a comment or question.
Yes, sir.
Thank you, Madam Chair. I'm not proposing to engage in dialogue, but and I respect your opinion on the matter, but I did want to just correct a statement which you began your comments with, and that is that voters sent the message to us that they were opposed to resolving any fiscal problems with more taxes on May 19th. If you read the front page, the third page of the Sacramento Bee today, they report on the top 2 state pollsters who counter that from polls they have taken. Prop 1A was defeated because Democrats joined anti-tax Republicans because they were opposed to Prop 1A because of a perceived spending cap. There were no taxes in 1B, C, D, E, F. So I just have to disclaim the myth that May 19th was about taxes.
Well, I believe that there, sir, with due respect, and I do mean due respect, there have been other polls also that have showed otherwise that have not been publicly released.
Well,
release them.
Well, thank you very much. Next.
Kyla Christopherson on behalf of the California Chamber of Commerce. We are also in opposition to this measure for the reasons previously stated. And also, I would like to add that currently, and just note that there are currently $5 billion, or just under $5 billion in pending proposals that would tax one segment of individuals, and that would be smokers. We believe that targeted taxes of this nature in the business community, employer community has consistently said that taking a targeted taxes approach is extremely harmful to the economy. Social engineering, targeting a single industry through a tax is bad tax policy, and we believe would be harmful to the economy and jobs. For that reason, we have designated SB 600 as a job killer measure. We believe that if taxes are necessary and appropriate, that a broad-based approach is the appropriate solution, which is why the California Chamber of Commerce in February did support the broad-based tax measures that were proposed then, and we supported the ones in the ballot measures, Prop 1A. And so we think that that was the appropriate approach then, and we also respectfully disagree that the voters, that it was just about the spending cap. We also concur with Caltax that the voters were sending the message that they did not desire any further tax increases, and we agree with that messaging. Thank you.
Thank you. Now, if you can just state your name and your position, please.
Dennis Sloper, California Distributors Association. The distributors are, in fact, the taxpayer, not the consumer. We're in opposition for many more reasons that have been allowed to be stated. Thank you.
Thank you.
Senator Brian Reese, representing the Neighborhood Market Association, about 2,200 independently owned grocery and convenience stores throughout California. Thank you.
Madam Chair, members, John Latimer on behalf of the California Retailers Association and also the California Grocers Association on this, in opposition for the reasons stated before.
If there's other opposition, if you can come up right away. So this is going to be the end of the opposition.
Madam Chair and members, Gavin McHugh on behalf of the California Manufacturers and Technology Association. We also oppose the bill.
Thank you very much. Open the committee to comments or questions. Senator DeSaulnier.
Just a comment as a co-author. I'm just really proud of the senator's good work, and I did want to make a comment. The Taxpayers Association mentioned the probability that sales would go to the internet. I had a bill last year that was vetoed by the governor that was sponsored by the Attorney General that was modeled after a New York law that would help stop that, and they were in opposition to that. It would have raised millions of dollars for the state. So it seems a little bit disingenuous, some of the comments. but good luck.
Senator Leno?
I wanted to ask Senator Padilla what familiarity you have with any kind of polling that has been done specifically on the issue of tobacco taxation.
I appreciate that question. I appreciate the differing view on what message voters sent or didn't send on May 19th. To be more specific about one of the polls that you referenced, our information shows that 72% of people surveyed support the tobacco tax increase. And even more specifically, among the people who voted no on Proposition 1A, I believe the figure's at about 63% support a tobacco tax increase specifically. So I too don't buy into the notion that the voters sent a no new taxes message on May 19th. I believe, if anything, they sent a don't ask us to vote on it. We elected you guys go figure out the budget message on May 19th. But when asked a specific question about a tobacco tax increase, not only does it poll in the 70s in the shadow of May 19th, but even amongst people who voted no on Prop 1A, it is well over 50%.
So just to reiterate, 63% of those who voted no May 19th on Prop 1A support a tobacco tax. Does the questioning get any more refined as to what level of taxation voters might? What's the threshold where there's lesser support?
I'll lean on the sponsors for additional detail, but I do recall it.
Anyone happen to know that?
Being specific, was it?
I would imagine there's a threshold at some point, huh? Okay. Very good. Thank you.
Thank you.
I also am a co-author of the bill. I happen to think it's a good one, and I also happen to think that the message the voters were really sending us in May was, you figure out the problem, which is what we are in the process of really doing. So with that comment, are there any other comments? We are short of one committee member to have a quorum, so we're not able to vote on the bill. But certainly, as soon as we do, we'll do that.
Okay.
Thank you for.
If I may, just sort of in closing.
Yes, in closing.
A couple of comments, and then make myself available to come back from Banking Committee to answer questions that may arise with members who have yet to come to committee. But from the opposition, a couple of statements were made that I think are worth refuting. Number one, the concern about this being a declining source of revenue. That would be a great problem to have. But for every opponent argument that because this is a declining source of revenue, we ought not do this, I encourage us to take a complete look at the picture. With a declining source of revenue, we're going to save on health care costs, both directly and indirectly, because people are smoking less. And as people are smoking less, not only are we saving on those direct and indirect costs, but we're going to improve productivity. Not only workers being able to not have to take a day off of work to see a doctor or battle their emphysema, but kids who maybe because of secondhand smoke are missing out on school will be attending school, et cetera, et cetera. So if we want to take a look at the costs, let's take the complete picture of costs. Second, that taxes are too high or tobacco taxes are too high. And again, we haven't raised tobacco taxes in 10 years in California. We now rank 32nd in the nation. So we were once upon a time a leader in this arena, and now we need to catch up. So this will put us in the top 5. We talked about the May 19th and what message that did send or didn't send. And lastly, that this is a regressive tax, and woe's me, this is going to impact communities of color, the lower income communities of our state. While that may be true, I'm compelled to say that so do the health consequences of smoking. The health consequences of smoking for smokers and victims of secondhand smoke are also disproportionately communities of color and low-income communities. So to me, those far outweigh the $1.50 a pack impact on those families. Thank you.
Senator Padilla, I want to thank you very much. It won't be possible to have another discussion when we have other members. We have 15 bills, and at 30 minutes per bill, we're going to be here many hours. But you've made your point, and I know that your sponsors will be available in the back if, there are any questions someone in the audience wishes to ask.
Thank you very much.
Thank you very much. Okay. Next, we have item 2, Assemblywoman Hayashi, AB 108, individual health care coverage. Welcome.
Thank you, Madam Chair and members. I am here to present to you AB 108.
And I understand you have 2 bills, so this is the first of the 2.
Yes, the next one is AB 235. Before I begin, I want to accept author's amendments suggested by the committee consultants. AB 108 addresses the problem of rescission in the healthcare industry. Consumers need to know that they could count on their healthcare insurance and that it will not be taken away from them when they need it most. AB 108 sets a clearly defined and reasonable 18-month period for both health plans and health insurers to review an individual health plan application. It bans rescission for any reason after 18 months. Once the policy is issued, the underwriting process must be completed within the 18 months. And this is an important and much-needed consumer protection measure. I urge your support.
Thank you, Ms. Hayashi. We have those in support of AB 108. Who would like to speak?
Go ahead. Please go ahead.
Going once? Going twice?
Thank you, Mr. Chair and members. Teresa Stark with the California Medical Association in strong support of the bill. It's a strong consumer protection bill for individuals who count on their health insurance when they need it the most. Thank you.
Thank you.
I'm Senior Assembly Member Lola Young on behalf of the California Senior Legislature. And seniors, as you know, are really affected by health insurance, and we feel that this is an important bill, and we are in strong support.
Paloma Perez on behalf of the Consumer Attorneys of California also support this bill. While we believe nobody should have their health care rescinded as a result of an innocent mistake, we also believe that they should be rescinded under no circumstances after the 18-month mark has passed.
Okay. Anyone else who wishes to state their name and that they're in support? Witnesses in opposition?
Jason Gappert with the Association of California Life and Health Insurance Companies. We're opposed for a couple of reasons. We believe the bill is unnecessary. As part of the settlements with the CDI, a few of our companies have already changed their application forms, their underwriting process, and some have even had independent third-party review to review the rescission process. Secondly, current law restricts health insurers that are regulated by the Department of Insurance. After 2 years, you can't rescind unless you can prove fraud. This bill will reduce that to 18 months and take out the fraud exceptions. We feel that our company should be able to still rescind a contract after 2 years or any time if someone lied on their application in order to get health care coverage. And we also wanted to point out that underwriting must be completed up front in order for the policy to be given to the person. This 2 years isn't, we don't use the 2 years to do underwriting. It has to be done up front in order for the policy to be given. Thank you.
Thank you, Madam Chair and members. Nick Luizos, California Association of Health Plans. We have a slightly different position than our partner trade. We have an opposed unless amended position. As a committee has heard in past testimony on this issue, rescissions are rarely used in the individual market, but we do feel that it is a valid tool when somebody has not disclosed the proper information in their application for health care coverage. We would not oppose language that's reflective of what's currently in the insurance code per what ACLIC has testified to. Thank you.
On her close, Assemblywoman Hayashi will address your concerns. At this point, is there anyone else in opposition? Are there comments from committee? Assemblywoman? Senator Cedillo?
No, you go ahead.
Just with respect to the construction of your bill, does the bill avoid, simply by us passing it, conflict with contract laws as they relate to rules related to rescission? So fraud, right, material mistake, fact, etc.
Thank you, and I think I can answer your question and also address the issues that were raised by the opponents of the bill.
Might I also say that the bill if it passes out as amended, it would go to Judish. So briefly, if you want to answer some of this, but mainly on the health piece, yes.
First of all, if you're a member of HMO, you do not have the 2-year protection. The insurance code allows PPO members the 2-year protection. So if you've lied on your form, then the insurance companies can, in fact, rescind within that first 2 years. If you're a member of an HMO, then you do not have that protection. So this bill simply extends that same benefits to HMO members. And most of the rescissions actually occur with an HMO plan as opposed to PPOs. And in terms of the fraud protection, there have been several court cases where the judges have ruled that just because you give insurance companies 18 months or 2 years, that doesn't mean that that's condoning fraud. I think one of the gentlemen referred to completing underwriting, and that's exactly what we're trying to get at. If they could review the individual application the front end, and because right now the current law allows insurance companies to decline application. They have that right. So all we're saying is if you're collecting someone's premium for 18 months, then you have to cover them and give them the benefits that they're entitled to. If you don't want to cover them, then that's fine because the state law says you're not guaranteed acceptance. This is a very modest and reasonable reform, and I think, what I'm trying to do here is offer those members of HMO plans the same rights that PPO member currently has. And I hope that answers your question.
I have a question.
Senator Leno.
That's a very clear explanation and answer to Senator Cedillo's question. Do you know how that differentiation between PPOs and HMOs came to be? Do you know any history of that? Well, PPOs regulated by insurance code, and HMOs are in health and safety code, and so don't have the exact background on why the PPOs would have that protection, but this would just give both types of plans and the members same rights. Very good. Thank you. Yeah. Thank you. We have a quorum? No, we're still short.
We keep having 5 members, but they're 5 different members, so we're not quite to 6. Okay, so we're not able to. Well, maybe we have 5.5, but we're not quite to 6, so we're not able to vote on the bill at this moment in time. But when we are able to, we will. So thank you very much for your presentation. I know you have a second bill, which is file item 5, AB 235, Emergency Services and Care.
Thank you. Madam Chair and members, I'm pleased to present to you AB 235. This bill seeks to clarify the role of hospitals and health care providers when a patient is seeking care for psychiatric emergency services. Some consumers, while in the midst of a psychiatric medical emergency, have been asked to obtain prior authorization in order to access health care, including the admission or transfer to an inpatient psychiatric unit within a hospital. This bill is sponsored by the California Hospital Association. Today I have with me Dr. Joseph Walker, who is a member of Board of Trustees of the Hospital Association, to testify in support of the bill.
Good afternoon, Madam.
2 witnesses, 2 minutes each, 3 minutes each.
Okay, Madam Chairman, thank you, and
Good
members
afternoon.
of the committee. The goal of parity in the provision of medical treatment to physical and mental disorders is a long-established goal in the state of California, and a number of revisions to existing law have been necessary to move us closer to that. AB 235 is conceived in exactly that spirit to move us closer to the idea of parity. EMTALA legislation that we're all familiar with essentially defined the responsibility of emergency rooms to provide services to any individual to move them from a condition of emergent to stable condition, or at least to do so within the capacity or the limitations of that particular facility. Because of the tremendous variability in the availability of that personnel and expertise, many emergency rooms throughout the state do not have access to the kind of expertise necessary to move a patient from emergent to stable position. And in fact, that expertise may only be available on an acute psychiatric inpatient unit, whether in a general hospital or a freestanding psychiatric facility. AB 235 does a number of things to try to address the sort of the resultant problems from what I've just described. First of all, it provides a definition of psychiatric emergencies. Prior to this provision, health plans have had at their prerogative to have individual definitions of psychiatric emergency and to in fact require prior authorization before they engage financial responsibility for that admission. This bill, in addition to defining a psychiatric emergency in a consensual way, which I think should simplify things enormously, would also essentially engage EMTALA's requirement that health plans pay for the emergency services and apply that to the fact that admission may be a part of what's necessary in order to stabilize an emergent psychiatric condition. In an effort to address the concerns of the health plans as we've developed this bill, it does provide a mechanism by which emergency rooms can notify health plans, providing an opportunity for input as to which hospital a patient may go to, and in fact, if one is not available initially, there is a mechanism by which they can be a transfer can be arranged after stabilization has been reached to a contracted hospital. So it's my belief that the successful passage of AB 235 will move us closer, incrementally closer to the goal of parity in treatment. Thank you.
Next witness.
Senior Assembly Member Lola Young, on behalf of the California Senior Legislature, also in support of this bill.
Thank you.
Angela Blanchard on behalf of Psychiatric Solutions in strong support.
Judy Woolen with NAMI California in support.
Lillian Clark with the National Association of Social Workers in support.
Thank you. Anyone else who would like to speak in support? I understand there's no opposition.
It was actually on consent in the Assembly.
Yes. Well, we're very discriminating here. So,
I'm just pointing out the obvious.
Well, let's see. We don't have a quorum, so thank you. And when we do, we will put it up for a vote. Thank you very much. Okay. Which item? Assemblywoman Galgiani, and let's see.
3 and 13.
File item 3 and file item 13. Welcome.
Thank you, Madam Chair and members.
So this is AB 175.
Yes. Yes. Telemedicine is a growing model for healthcare delivery that's used to improve healthcare access in rural and underserved communities while reducing overall costs. Although optometrists are able to provide telemedicine services under current law does not allow for Medi-Cal reimbursement. This bill will allow optometrists to be reimbursed for providing telemedicine services under the Medi-Cal program, and thereby improving access in medically underserved rural areas where geographic barriers threaten these services. A recent review of AB 175 identified a cost savings to the general fund of about $2,500 per digital retinal screening to Medi-Cal and other publicly funded health and human services programs. So if 500 screenings were performed, the savings would be about $1.3 million to the state. I will be accepting amendments proposed by the committee staff referenced in the analysis, and I'm pleased to have with me Katie Trueworthy on behalf of the Department of Healthcare Services, who is the sponsor of AB 175, here to testify in support and answer any technical questions.
Thank you. Before we do that, this room really carries sound very well. It's well constructed. So it's going to be very important that nobody is really talking on a cell phone or talking to anyone else. And if you wish to talk to someone else, if you could respectfully take the conversation into the hall, we would really appreciate it, because we really need to hear everything that is said. Thank you. Witnesses.
Katie Trueworthy with the Department of Healthcare Services. Want to thank the Assembly member for carrying this important piece of legislation and urge your support.
Thank you.
Yes, hello. My name is Dr. Donnie Hsu of the Department of Healthcare Services Medi-Cal Vision Care Program, and I'm here in support of AB 175.
Thank you.
Terry McHale with Aaron Reed and Associates, representing the California Optometric Association. Pleased to be in support of this bill.
Thank you. Anyone else in support?
That changes.
Comments from the committee? I understand there's no opposition.
I ask for your aye vote.
And when we have a quorum, we will vote on it. Yes, thank you very much.
Thank you.
Now you have file item 13.
Yes, AB 896.
Okay.
Children's hospitals provide vital services to the most seriously ill children whose needs in a time of economic crisis will only grow. A cut in provider reimbursement directly impacts access to care. Historically, hospitals have been reimbursed for non-Medi-Cal California Children's Services patients based on 90% of the interim rate or the Medi-Cal allowable cost-based rate, regardless of the hospital's contracting status with California Medical Assistance Commission, or CMAC. After a recent legal review of the statute governing CCS reimbursement, the Department of Healthcare Services was considering reimbursing hospitals at their CMAC negotiated rate and also recouping payments from hospitals for an unknown prior period. AB 2474 of last year sought to clarify reimbursement for non-Medi-Cal CCS patients and the Genetically Handicapped Persons Program to be 90% of the Medi-Cal hospital interim rate of payment developed by Department of Healthcare Services. This bill contained a provision for a sunset on January 1st of 2010. This bill seeks to protect hospitals that provide this care and subject to retroactive recoupments and remove the January 2010 sunset date. It was never the intent of DHCS that these high-cost services to seriously ill children be reimbursed at an amount that's actually less than Medi-Cal allowable costs. I'm pleased to have with me today Sharita Lane on behalf of California Children's Hospitals to testify in support and to offer technical assistance and answer any questions that you have. I ask for your aye vote.
Thank you.
Hi, I'm Sharita Lane with the California Children's Hospital Association. We're pleased to be the sponsor of AB 896. As the Assembly member referenced this
We're going
bill,
to stop for one moment. I see Senator Onestad. And we're going to do the vote for the quorum. Pardon me? And we can open the roll on the bills that we've had so far. Good idea. Okay.
Senator Alquist?
This is for the quorum here.
Alquist here. Strickland? Here. Strickland here. Onestad? Here. Onestad here. Cedillo? Here. Cedillo here. Cox? DeSagne? Leno? Here. Leno here. Maldonado? Negretti McLeod? Pavley? Woke. Oh, I'm sorry. Pavley here. Woke.
We've established the quorum, and we will vote on the bills we've heard so far. I do know that we have a lot of members in other committees, so we will hold, even if we have enough votes to get the bill out, we will hold the roll open on all the bills and then do the final vote at the end. So let's begin with item 1.
Senate Bill 600.
I move the bill.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onestad? No. Onestad, no. Cedillo? Aye. Cedillo, aye. Cox? DeSagne? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Pavley? Aye. Pavley, aye. Woke. It's got 4.
That bill has 4 votes. It is on call. Item 2, AB 108, Assemblywoman Hayashi.
I move the bill.
Bill has been moved.
Senator Alquist?
Aye.
Alquist, aye. Strickland? No. Strickland, no. Onestad? Onestad, no. Cedillo? Aye. Cedillo, aye. Cox? DeSagne? Correct. Leno?
Aye.
Leno, aye. Maldonado? Aye. Maldonado, aye. Negretti McLeod? Pavley? Aye. Pavley, aye. Woke. It's got 5 ayes.
That bill has 5 votes. It is on call. Item 3, AB 175 by Assemblywoman Galgiani.
I move the bill.
Bill's been moved.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onestad?
Aye.
Onestad, aye. Cedillo?
Next one.
Cedillo, aye. Cox? DeSagne? Leno?
Aye.
Leno, aye. Maldonado?
Aye.
Maldonado, aye. Negretti McLeod? Pavley? Aye. Pavley, aye. Woke. 7.
That bill has 7 votes, which is enough to get out, but we are keeping all the bills on call. Item 5. Item 5, Assemblywoman Hayashi, AB 235. The bill has been moved by Senator Pavley.
Senator Alquist.
Aye.
Alquist, aye. Strickland.
Aye.
Strickland, aye. Onnested.
No.
Onnested, no. Cedillo.
Is that it?
Yes.
Cedillo, aye. Cox. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Maldonado, aye. Negretti McLeod. Pavley. Pavley, aye. Woke. It's got 6.
That bill has 6 votes. Enough to get out, but it is on call. Now, yes, we were in the middle of file item 13, Assemblywoman Galgiani, AB 896.
Madam Chair, members, my name is Sharita Lane, and I'm with the California Children's Hospital Association. We're pleased to be the sponsor of AB 896, which would extend the sunset date that was included in last year's AB 2474 relating to reimbursement, hospital inpatient reimbursement for California Children's Services programs patients. This program covers children with serious illnesses such as muscular dystrophy, childhood cancer, and cystic fibrosis. Most children are enrolled in Medi-Cal that are enrolled in this program, but there are a few who are enrolled in Healthy Families and then a few who do not qualify for either program. And we are, this bill addresses those that are not enrolled in Medi-Cal. The costs of providing care to these children are significant due to the acuity of their illnesses and the resources associated with the cost of their care. Unlike the Medi-Cal program, these are only high-cost services because of the severity of their illnesses. So when a hospital negotiates with CMAQ for a CMAQ rate, they are considering all the services provided to the Medi-Cal population and not just the high-end, resource-intensive services that are provided to this small population. We are already experiencing compromised access. We've had a children's hospital that spent more than a year recruiting for 2 pediatric neurologists. Further reductions in reimbursement for California's children's hospitals, which treat a disproportionate number of these children, would only further compromise access to care for these seriously ill children. We urge your aye vote. Thank you.
Madam Chair and members, Barbara Glazer with the California Hospital Association in strong support.
Madam Chair, I'll just say, people are wondering why I'm sitting here. I'm proudly with the California Children's Hospitals Association, and I gave my time to Sharita, who is far more knowledgeable.
It's always nice to see you, Mr. Reed.
Thank you.
I understand there's no opposition, none received anyway.
I move the bill.
Bill's been moved. Are there any comments from committee? Would you like to close very briefly?
I respectfully ask for your aye vote.
Thank you very much. And the bill was moved by Senator Leno.
Senator Alquist.
Aye.
Alquist, aye. Strickland.
Aye.
Strickland, aye. Onnested. Cedillo. Cedillo, aye. Cox. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Maldonado, aye. Negretti McLeod. Pavley. Aye. Pavley, aye. Woke. It's got 6.
6 votes, and we're keeping all the bills on call. Thank you very much.
Thank you.
Next, we have file item 4, AB 215, Assemblyman Fuhr. There's another Assemblyman. Welcome.
Thank you very much, Madam Chair.
We have 2. Okay.
Members, Mr. Smythe and I are the joint authors of this measure, reflecting the strong bipartisan support this bill has had throughout its process. It's a very straightforward bill dealing with a paradigm that all of us are too familiar with, and that is how difficult it is for people searching for a nursing home for a loved one find the process. It's not very transparent. People don't have a good sense of comparative quality one nursing home to another, yet it's among the most fundamental decisions that we can make in our families with potentially life and death consequences for our loved ones. The measure is very straightforward. It would require that nursing homes post a star-rated grade in their windows. And by the way, we are pleased to take the two amendments as authors' amendments recommended by the committee staff. This posting would make clear to anybody going to the nursing home where the nursing home stood. Very straightforward. Many counties do this for restaurants. It's the least we could do for our loved ones to do something similar for nursing homes. Rich and I vote with my colleague, Mr. Smythe.
Thank you. Madam Chair and committee, that the other thing to be clear is that this is not creating some new system, some new bureaucracy. It's already in place. We're just asking it to now be disclosed in a more public forum. Obviously, many of us may have already seen this or seen our families go through it with our grandparents about trying to find those tough decisions and doing it in a very quick and a very stressful time. And to try and research all of this on the internet at times can be very taxing. So to have that right there disclosed for the public for easy access, easy determination is a way to just help families make these tough decisions. And we obviously have some witnesses in support as well. It's a pleasure.
Thank you. Witnesses in support.
Great. Good afternoon, Madam Chair, members of the committee. My name is Jeff Gunzenhauser. I'm a physician and the medical director at the Los Angeles County Department of Public Health. I'm representing Los Angeles County, which is in support of this bill. This is a statewide measure that benefits all Californians. The 5-star rating system provides important information that's not only useful to consumers, but also to the 100,000 individuals who are currently in nursing homes in the state right now. Since 2007, Los Angeles County has sought to develop and provide meaningful information to consumers about the quality of nursing homes. This is because we've got 30,000 individuals in our 390 nursing homes, because we estimate that the number of individuals who are 65 years of age or older will double by the year 2030, and also because there's more than 325,000 baby boomers currently living in Los Angeles County that will develop Alzheimer's sometime during their life. So the demand for this information is not only currently present, but will dramatically increase in the near future. Because the county doesn't have the authority to mandate a rating system, we were working with the California Department of Public Health and the Federal Center for Medicare and Medicaid Services to develop some type of rating system. Fortunately, as someone viewer has pointed out, last December, CMS launched its 5-star rating system, which is not only comprehensive, but it also assesses staffing levels in relation to the number of residents present, how sick they are, and also includes important measures of quality. The distillation of all this information into a simple 5-star rating provides us an excellent starting point for consumers not only to understand but to recognize information about nursing homes. Unfortunately, many consumers don't have access to this because the ratings are only available on the internet. By requiring that facilities post the CMS ratings in very visible locations, this measure is designed to assure that consumers have greater access and greater awareness to this very important information. Therefore, I urge your aye vote for this very important measure. Thank you.
Madam Chair, members of the committee, I'm Gary Passmore, representing the Congress of California Seniors. While we recognize that there are some shortcomings in the CMS 5-star rating system that's going to be used here, we think a lot of those can be worked out. It is a relatively new system. And as the co-authors said, it includes information but brings it together, frankly, in a shorthanded way that the average consumer can comprehend very quickly. We hope that what will happen is that people who are looking for a good nursing home for a member of their family or a loved one or a friend will start a dialogue with the nursing home that they're interested in or look at several nursing homes. This is one piece of information that's currently available, but because it's simple, it may be the most effective that's going to be available, and we strongly support this bill.
Thank you. Is there opposition?
More support.
More support. Please come on up. And we've had the two witnesses, so at this point, if you could just state your name and that you are in support, we would appreciate it.
Hassel.
Into the microphone, please.
Julia Hassel, and I'm speaking on behalf of AARP's 3.5 million members. We are in support of AB 215.
Thank you very much.
Mary Melman, we're in support. Thank you.
Thank you. Any other support? Is there any opposition? Comments from the committee?
Madam Chair, I want to vote for this just because these two men are standing next to each other. in agreement with the
Whatever it takes. Huh?
the same subject matter. I mean, this is we got to develop this type of
Right, bipartisan. Yes, this is really a good sign.
I
Yes.
move the bill.
Yes, and I want to say that I'm very supportive of the bill. I carried the original legislation signed into law on documented violations of nursing homes being posted on the internet, and I think this is very complimentary. Senator Leno?
Joseph, support the rating of restaurants.
No, that's
And there's been a motion on the bill.
I just had a question.
Yes, Senator Pavley.
Federal system with criteria, and we're just finding a way to make it simpler to
Yes.
the average person to look at it. And I think what it also does, it creates a little competition to improve your facility
You bet.
in order to get that additional star. So it's sort of a double win. I tried to do one on child care centers and ran into some interesting issues. And I was a joint author with then Assemblymember John Benoit. The governor vetoed it for that bipartisan support on child care centers. So I wish you good luck with this. It's a good consumer-friendly approach.
Thank you. The bill has been moved, and the motion is due pass as amended to appropriations.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo?
Aye.
Cedillo, aye. Cox? DeSagne? DeSagne, aye. Leno? Leno, aye. Maldonado? Maldonado, aye. Negretti McLeod? Pavley?
Carter.
Pavley, aye. Woke.
It's got 7. That bill does have enough votes to get up, but we're putting all the bills on call.
Thank you, Senators.
Thank you. Assemblywoman Carter. File item 6, AB 249. And then do we have some other members here?
Have the sergeant start calling the members
Yeah,
who have been presented.
Peter, we
Tell
need.
him once he gets back.
Okay. And we will be looking for authors, assembly authors in Senate Health Committee. Anyway, welcome, Assemblywoman Carter.
Thank you, Madam Chair and members. AB 249 will require an institution that provides convalescent care to patients to mark and otherwise permanently identify by owner and serial number
Move
each
the bill.
patient's
Move the bill.
privately owned vital mobility, hearing, or breathing equipment. This bill will help disabled and California seniors keep track of their equipment and aid them in its recovery should it be lost or stolen. The bill has had unanimous support throughout the Assembly and has members of both sides of the aisles as co-authors, and I ask for your aye vote.
Thank you very much. Witnesses in support. There is opposition, so we will go through the whole process. Yes.
I appreciate it. Thank you.
I'm Senior Assembly Member Lola Young, and California Senior Legislature are proud sponsors of this bill. It's a very important bill because when you're in a nursing home, and my late husband, for instance, has a cane that is adjustable, that it looks like 1,000 other canes that are taken care of. Had he been in a nursing home, there would be no way other than a marking that would be able to identify his cane. In a nursing home with that many beds, it would be impossible to keep track of. So this bill just is a way to say, this is whoever it belongs to. It's an important bill, especially in nursing homes.
Gary Passmore, Congress of California Seniors. We support this bill.
Thank you.
Mary Melman, AARP volunteer for 3.4 million voters, and we definitely support this.
Thank you.
I'm Mary Beth Granger representing AARP, and we support this bill.
Thank you. Anyone
Strongly.
else who would like to speak in support? Witnesses in opposition.
DPH will argue that they can do this administratively through regulation. The bill will require things to have the serial for a month, and you can ask the author to respond under close.
Welcome.
Thank you. I'm Jennifer Simoes, the California Department of Public Health. We have an approved opposed position on this bill. Long-term care facilities are currently required to implement a theft and loss prevention program, which includes a listing of patients' personal property inventory in current law. If the department believed that requiring a listing of specified patient-owned property by unique identification number was necessary, this requirement could be accomplished through current statutory authorities. Because this bill can be accomplished administratively, we're opposed.
Thank you. Next.
Kristen Heyman with Aging Services of California, representing over 100 skilled nursing providers across the state. While we're very sympathetic to seniors who are victims of personal property theft, we regretfully oppose this bill. Currently, there are several oversight mechanisms already in place dealing with identification purposes in long-term care facilities. Long-term care facilities are required by law to have a theft and loss program in place, and existing law already requires the program to include the establishment of method marking personal property upon admission. Although we commend the author for her commitment to protecting older adults, we believe this bill is duplicative in nature. Thank you.
Thank you. On your close, which is not yet, but on your close, if you could address the concerns that were stated, I would appreciate it. Comments from committee members?
Just a comment as I move the bill. I just want to say that I think the reason the department gave for opposing the bill is the reason why we need the bill. That they have the authority, they're not making use of it. Consumers are requesting this. If you're not doing it, we'll make sure that you do. So I move the bill.
I thought it was a very good answer.
That was my close.
That was your close. Well, that was a great close.
The law has not been implemented, nor is there a timetable for which it will be.
Right.
What's going to be the enforcement strategy then?
The enforcement strategy will be the fact that they will be required, this bill will require that they mark it with a pin that's indelible, and so that patients can identify, patients and their families can identify their belonging. They would be required to do it.
The bill was moved by
Send a cop down. Then the Department of Public Health will be forced to do it. Will be required to do it. I won't use the word force.
Well, this was in another state called Missouri, but I do know of a personal experience where a family member had things stolen, important things stolen from a locker, and I think this is really important.
Because of the black market issue right now, it's really important that we make sure that their belongings get the appropriate markings.
Thank you. Well, the bill has been moved. Actually, was it Senator Strickland? And then Senator Leno also moved the bill, so the bill has been moved. Call for the vote, please. And this is to do pass to appropriations.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Strickland, aye. Onnested? Cedillo? Cox? DeSagne? Leno?
Aye.
Leno, aye. Maldonado? Aye. Maldonado, aye. Negretti McLeod? Pavley? Pavley, aye. Woke? Cedillo, aye.
The bill has 6 votes. We are keeping all of the bills on call.
Thank you so much.
Thank you very much. Next, we have file item 7, AB 354, Assemblyman Arambula. And then we need, we have Ma, Huffman, Hill,
Assemblymember Hill is here too.
Lowenthal. Welcome.
Thank you, Madam Chair. Good afternoon. It's my pleasure to present Assembly Bill 354 before you this afternoon. This bill deals with pertussis, with a booster vaccine for pertussis, which is more commonly known as whooping cough. And Madam Chair and members, I have some personal experience with this, having contracted whooping cough when I was 2 or 3 years old, nearly died from it. And it is the only disease that remains widespread in California. Despite high levels of vaccination in early childhood. While routine childhood immunization is effective, immunity from the vaccine begins to wane after 5 to 10 years, therefore requiring a booster vaccine. The difficulty is that California is currently prevented from requiring an immunization booster due to the antiquated wording of its school entry law. by deleting the age restrictions of pertussis and several other immunizations. AB 354 will allow the Department of Public Health to adopt the most current immunization recommendations of the Center for Disease Control's Federal Advisory Committee on Immunization Practices. This bill, Madam Chair and members, is supported by the California Medical Association, the American Academy of Pediatrics, and the California Immunization Coalition. I would respectfully ask for an aye vote.
Witnesses, 3 minutes each in support.
Good afternoon. My name is Catherine Flores Martin. I'm director for the California Immunization Coalition, and we work in partnership with healthcare leaders and advocates throughout California and the United States to ensure that all Californians are protected against vaccine-preventable diseases through immunization. This bill simply updates California statute to reflect current national recommendations. As Assemblymember Brambilla said, our current statute is out of date, and it limits the state to make changes that will impact children's lives and keep them healthy. I'm here to answer any questions and just let you know that we are in strong support of this bill.
Thank you.
I'm Dr. Dean Blumberg, Associate Professor of Pediatric Infectious Diseases at UC Davis Medical Center here in Sacramento. And I'm also testifying on behalf of California American Academy of Pediatrics, representing over 5,000 board-certified pediatricians in California. And as the Assembly member has mentioned, the pertussis can be a very severe disease in young infants. However, there's recent appreciation that the young infants get it from older adolescents and adults. And because of this, new vaccines have been developed for adolescents and adults, but current state law precludes their use in that age group. And so this bill will update state law to allow the Department of Public Health to use all the tools that are necessary to address these outbreaks. Thank you.
Thank you very much. Other witnesses, just state your name, please, and position.
Lydia Bourne. I'm a board member on the California Immunization Coalition, in strong support.
Thank you.
Liz Helms, on behalf of the California Academy of Family Physicians, in strong support.
Thank you.
Teresa Stark, California Medical Association, in support.
Thank you. Anyone else in support? Witnesses in opposition?
Madam Chair?
Yes.
I move the bill and want to thank the author. I think the underlying principle of this bill is that it restores science to the decision-making processes we make as policymakers, and that's where it should be. And I think those in support document that fact.
Thank you very much. Sarah Pavley?
Just a clarification in the close. I noticed similar legislation has been vetoed numerous times and lots of times held in Assembly appropriations, and maybe this bill is somewhat different with the flexibility on the administration.
If Assemblyman Arambula would like to speak to that.
Yes, thank you, Madam Chair and members. We have worked with the administration to resolve any concerns that they may have. I believe that if the committee approves this bill and it's ultimately adopted by the legislature, that it would be welcomed by the administration.
Well, the recommendation is support as amended, and the motion, once we have it, would be do pass as amended to appropriations.
Yes, ma'am.
So do we have a motion?
Yes, Senator.
Yes, Senator Leonard moved. So we'll call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Honested? Cedillo? Cedillo, aye. Cox? DeSagne? Leno?
Aye.
Leno, aye. Maldonado? Maldonado, aye. Negretti McLeod? Pavley?
Aye.
Pavley, aye. Woke. That's got 5 votes.
That bill has 5 votes.
Thank you,
It is
Madam
on
Chair.
call.
Thank you, members.
Thank you very much. Assemblymember Hill, file item 8, AB 574.
And I guess, yeah, I saw Yamana, but I didn't know if you wanted to take her in, in Lowenthal's place or like a retail at the end. Or...
Oh, I didn't even where.
Yeah, she's presenting. It's on your agenda.
What is she?
She's presenting for Assemblyman.
Thank you, Madam Chair and Senators.
I'm here to present AB 574. Despite California's remarkable success in reducing the costs and suffering caused by smoking tobacco use remains the principal cause of preventable death and disease in the state and in the nation. Current law prohibits smoking in buildings and areas adjacent to entrances. AB 574 would extend these limits to the entire hospital campus to improve the chances of this population quitting smoking. In California, 73 hospitals have voluntarily prohibited smoking throughout their campuses. 1,250 private and public hospitals across the nation have chosen to establish smoke-free campus policies. Most of these hospitals adopted this policy to help their employees and patients, and because they found smoking to be profoundly contrary to their hospital's mission of treating the ill and promoting public health. These hospitals report almost no problems with compliance or enforcement of these restrictions, and national research confirms that substantial increases in successful quits by both patients and employees when smoking is controlled. AB 574 is co-sponsored by Breathe California and the California Tobacco Control Alliance and is supported by a broad coalition of public health organizations, and at this point there is no opposition to it, we're proud to announce. And on a personal note, private hospital in the county that I represented in the district had a smoking kiosk right outside, right next to the walking path from the garage to the front entrance, which presented a problem. The only way to avoid that would be to walk in the street going to the hospital. So it was kind of an uncomfortable condition, and one that I experienced personally. So I certainly ask for your support for this measure. And Carolyn Martin from California Tobacco Control Alliance and Andy Katz from Breathe California are here to support that. Thank you, Madam Chair.
Welcome.
Senators, it's obvious that hospitals whose mission is healing and promoting public health should encourage employees, staff, and visitors to quit smoking and to protect everyone from a toxic air contaminant, secondhand smoke. More and more hospitals are honoring this purpose by making the entire hospital campus completely smoke-free. This policy results in significant decreases in employee smoking, which reduces health care costs, and it motivates patients and visitors to quit. Smoke-free hospitals just make sense. In a Kaiser survey of both employees and patients, 90% of non-smokers, and believe it or not, 80% of smokers supported the policy. This legislation provides the essential element for enforcement, signage. Some hospitals, such as UC Davis, which went smoke-free last July, completely, the 143-acre campus, added to their phone appointment messages reminders that to the patients that the campus is smoke-free. In addition, they give out free Nicorette gum if you have a nicotine fit while at the hospital. And there is lots of information about cessation classes and the free helpline from the state. The hospitals report very few enforcement problems, and they prefer to rely on their own security staff to resolve any issues. We urge a yes vote on this common sense step to continue California's remarkable success in reducing the costs and suffering caused by tobacco use. Thank you.
Thank you. Good afternoon, Senators. My name is Andy Katz. I'm representing Breathe California. And this bill for us is about helping people to quit smoking. We find that 70% of adult smokers want to quit, and from our organization's perspective, we help at Breathe California to help people quit. We provide cessation classes, but we found that it takes a lot of reinforcement. It takes reinforcement and a supportive environment to help smokers quit. And what this bill would do is provide a supportive environment on the hospital campus because the hospital is able to provide cessation services, and this bill would ensure that there is signage and an actual policy backed by state law. This bill has no fines that would be imposed on the hospitals and imposes no fiscal costs on the Department of Public Health. In addition, it's backed by research that shows that it actually does help people quit. For other states and other hospital groups that have had policies like this, it helps ensure that there is a higher quit rate. It does have lower incidence of heart attack and other lung disease. And so for those reasons, we are asking for your support to have smoke-free hospitals for California.
Thank you very much. Others, please state your name and position.
Paul Neprath, on behalf of the American Lung Association of California, we're in support of the bill.
Teresa Stark, California Medical Association, in support.
Thank you. I don't think there's any opposition. I don't think there's any opposition, is there? Comments from committee?
Madam Chair, I move the bill, and if there's the opportunity to be added as a co-author, I would like that.
We'll make sure that. Thank you.
Thank you. And I also would like to be added as a co-author.
Thank you, Madam Chair.
when
It'd be an
appropriate.
honor.
Thank you. The motion is due pass to appropriates, and the bill has been moved by Senator Leno. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onnested? No. Onnested, no. Cedillo? Cox? DeSagne? Leno?
Aye.
Leno, aye. Maldonado?
Aye.
Maldonado, aye. Negrani McLeod? Pavley?
Aye.
Pavley, aye. Woke. It's got 4.
That bill has 4 votes. It is on call.
Thank you, Madam. Thank you very much, Madam Chair.
Thank you. File item 9, which is AB 577 by Assemblywoman Lowenthal, will be presented by Assemblywoman Yamada.
That explains why she was sitting there.
That explains, yes. Welcome.
Thank you, Madam Chair and members. It is my privilege to present AB 577 on behalf of Chairwoman of the Aging and Long-Term Care Committee in the Assembly, Bonnie Lowenthal. Thank you for allowing me to do this on her behalf. AB 577 is a bill that will provide some technical cleanup and allow the programs for all-inclusive care for the elderly and their management to become more efficient and more streamlined by providing more clarity in the way in which exemptions and other licenses are granted and processed. And with me today, I have Erin Levi representing CalPACE to answer additional questions and other representatives in support of this bill.
Thank you.
Good afternoon, Erin Levi. I'm actually representing OnLock, and Fred here is representing CalPACE.
Okay.
Sure.
Thank you.
That'll work.
Although there's only 5 of us.
There's only 5.
Yeah, there's only 5 of us in the state. San Francisco and Santa Clara have OnLock, and Fred can go over the rest of them. But as you can imagine, we have numerous regulations because we provide integrated services through a Medi-Cal and Medicare financing. We often have services that are duplicative, or regulations are duplicative or inconsistent. And AB 847 back in 2005 allowed the Department of Health Care Services to really streamline these regulations. This is a technical cleanup bill to allow the department to take this one step further, and instead of a PACE program, each identifying the duplication of services and providing an exemption to the department would instead allow, in these instances, these programs to get exemptions on a statewide basis.
Thank you.
Fred Main, representing CalPACE, Association of the 5 PACE programs in California, in San Francisco, Alameda County, Sacramento County, San Diego, and LA. And we are co-sponsors of the bill and request your aye vote.
Thank you.
Kristen Heyman on behalf of Aging Services of California, representing our home and community-based service providers who are in support of the bill.
Thank you. Is there any opposition?
I move the bill.
Any comments from committee members? I want to thank Assemblywoman Lowenthal for taking the amendments that she took previously. We do appreciate it. The bill has been moved, and the motion is it's been moved by Senator Leno, and the motion is due pass to appropriations.
Thank you. Thanks.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onnested? Onnested, aye. Cedillo? Cox? DeSagne? Leno?
Aye.
Leno, aye. Maldonado?
Aye.
Maldonado, aye. Negrani McLeod? Pavley?
Aye.
Pavley, aye. Woke. It's got 6.
That bill has 6 votes. We are holding all the bills open.
Thank you very, very much.
Thank you very much.
Thanks.
Now, file item 10, AB 599, is being put over by the committee. And so we will go to file item 11
Mr. Emerson is here.
by Assemblyman Emerson, AB 839. Welcome.
Thank you, Madam Chair and members. Currently, when a Medi-Cal provider wants to appeal a denial of a claim for reimbursement, the law states that the providers may seek appropriate judicial remedies. This language is vague and fails to specify which legal remedy the provider should take. As a result, providers file a variety of actions for reimbursement that are unsuitable and therefore cause delays in the courts. By specifying that the appropriate legal remedy is by writ of mandate, this bill will make the appeals process more user-friendly and easier to follow for Medi-Cal providers and will create a speedy and equitable remedy for claims against the state. Furthermore, current law continues to penalize Medi-Cal providers and applicants when they appeal their denial and termination of enrollment. AB 839 will ensure that the denied applicant appeal process is fair to those providers who choose to appeal. This bill also makes conforming changes to the timelines for reapplication within the welfare and institution codes. I respectfully ask for your aye vote on this measure. To speak further and answer any questions you may have, I'd like to introduce Katie Trueworthy with the Department of Health Care Services and Daniel Pone, with Senior Attorney with the Judicial Council of California.
Good afternoon. Katie Trueworthy with the Department of Health Care Services. First, I'd like to thank Assemblymember Emerson for carrying this very important piece of legislation. We do think it's an inequity right now that when a provider appeals their right into the program, that the appeal date right now would start once their appeal has been exhausted. We think it's appropriate that on the date of the termination or expansion of their once they've appealed, we believe that it's should be at that point, not once the appeal has been exhausted. We also believe that the writ of mandate is the proper way for providers that are appealing billing claims. We believe that once they've gone through the appropriate Medi-Cal administrative appeal process, that they then are able to go do writ of mandate through that process. And I have with me Tony Lewis, who is our Assistant Chief Counsel with the Department of Health Care Services, who can answer any questions. This is pretty technical, so I wanted to bring the expert along just in case.
All right, so it's double referred.
Before we get into more detail, the bill has been also referred to Judish. So if it comes out of this committee, it will go to Judish, and that would be, of course, the appropriate place to ask more of the judicial issues.
It was referred to judiciary in the
right, and we're really dealing with health care issues in this committee. So yes, we could have one more witness speak for 3 minutes, if someone would like to, or else just to state your name and that you are in support.
Lisa Fulberg with the California Medical Association. As this committee knows, there's a huge problem with a shortage of physicians and other providers in the Medi-Cal program. And this bill will help to ensure that those providers who are willing to serve in the program are able to do so and don't have to wait as long as 10 years. We would urge your support.
Thank you.
Madam Chair, members, Dan Pone for the Judicial Council, also in support.
Is there any opposition? Comments from committee? Senator Onestad.
I understand the writ of mandate, which now gets into the legal realm, and as a non-lawyer, if I have a problem with the department over a Medi-Cal issue where that's at issue, I can see having to go hire a lawyer at my expense and going to court and go through the appeals process. But the second issue that you brought up, billing issues, I think is very detrimental, and I'm very surprised that the California Medical Association would be in support of this bill. Almost all of the claims, if there are fee disputes with Medi-Cal, would be below the $5,000 level, which can be done in a small claims court. In fact, most of the fees in dispute would be in the hundreds of dollars rather than the thousands of dollars, for which I am not about to go hire a lawyer, which is going to cost me probably twice that much just to hire the lawyer. And so I'm going to just give up. Today, my remedy is I can go to small claims court, or I can even send my business manager to small claims court and dispute and have this fee dispute taken care of without having to hire a lawyer and going through that expense. And so I can't, I guess I have questions as to how does this help the general practitioner? I see it as basically saying, hey, now if I have to hire a lawyer to go after the $1,200 that Medi-Cal owes me, but we're in a dispute, I'm going to just write it off, which I'm sure is what the department would love to have me do. But I can't understand why CMA would want me to do that.
Lisa Fulberg with the California Medical Association. We don't think that this restricts how a provider can currently adjudicate these problems because...
Well, specifically excludes going to small claims court.
Under current law, you first have to go through the administrative process, and if you appeal that, the only way to appeal is through a writ. Small claims does not handle writ. So our attorneys have taken a look at this and do not believe that this bill would change that.
I beg to differ. The way it really happens is if I go through the appeals process, which does not take a lawyer, I just write to the Medi-Cal people and say I don't agree with what you've reimbursed me for. They'll come back and say it's denied. Then, at least today, I have the option to say, okay, to heck with your appeals process. I'm going to small claims court, and we're going to let the judge decide.
Our counsel doesn't believe that that's currently an option for you because you have to file.
What I'm going to say is,
it's not only an option. I've done it.
Senator Onnested, your concern is heard, and the bill, if it gets out of this committee, will go to Judish, where would be the appropriate place to deal with this particular issue. Are there any other comments?
Why is it in this committee?
Because there are two pieces. There's the health piece, and then there's the legal piece. The judiciary piece. Are there any other comments?
Katie Trueworthy with the Department of Healthcare Services. If I might, Senator, we would be happy to meet with you before the Judiciary Committee to chat a little bit more about this. I think there is a little bit of a misunderstanding that we need to clarify in terms of what the writ of mandate, the process, the amount, who these providers are, and we'd be happy to meet with you as well as with Judicial Council and CMA to chat a little bit more about this. So I'd like to make that commitment before the next committee hearing.
Thank you. Thank you. All right. Senator Leno?
Dr. Onested's concerns notwithstanding, I was going to say congratulations on bringing the Department, the Judicial Council, and CMA all together on this issue. I'll move the bill.
It took a lot of effort, believe me.
The bill has been moved. The motion would be due pass to Judiciary Committee. Did you have a very brief close?
No, I just asked for an aye vote. Thank you.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? Cedillo? Cox? DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado?
Aye.
Maldonado, aye. Negrete McLeod? Pavley? Aye. Pavley, aye. Woke. It's got 4.
The bill has 4 votes. It'll be on call.
All right. Thank you.
Thank you very much. Members, we have 2 bills left.
3 bills.
3.
And Assemblymember Jones is here for the Committee on Health.
We have 3 bills left. It'll be file items 13, 14, and 15. And I know that Assemblyman Jones is here. We will also ask Assemblyman Ruskin and Assemblyman Hall to come in a very short amount of time, or one is here. Yes, I see him. Yes. So first we have, we'll do a file item 14, AB 1543, Committee on Health. Assemblyman Jones. Welcome.
Thank you, Madam Chair. Senators, AB 1543 is jointly authored by myself and the Vice Chair of the Assembly Health Committee, Mr. Nathan Fletcher. The bill essentially provides conforming changes to the requirements and standards that apply to Medicare supplement contracts and policies that are commonly known as Medigap policies. in order to make sure that our statutes are consistent with 2 recent federal law changes. The bill is an urgency measure with the goal of having it become law before the July 1st deadline.
Madam Chair, I'd like to
for
move the
states
bill.
to comply. I want to thank, in particular, the hard work of your staff in working with my staff and chief consultant in coming to final conclusion on the contents of the bill. We note that there is a recommended amendment. We're very happy to take that amendment. For timing purposes, with the indulgence of the chair and the committee, we'd ask for permission to take that amendment in the Appropriations Committee, but we're very happy to take that amendment.
That would be fine, and there's already a motion and no support that we know of, so if you could be brief in your comments, that would be great.
David Link with the Department of Insurance. We're the sponsor of the bill. Urge your aye vote.
Maureen Higgins, representing America's Health Insurance Plans. We appreciate the work of the author, the committee staff, and the sponsor, and urge your aye vote.
I just want to thank Mr. Assemblyman Jones and your staff for the hard work in ensuring that California is in compliance with federal law. Appreciate what you're doing in this area.
Thank you, and I want to thank in particular my chief consultant, Deborah Kelch, who has labored many hours on this, along as your consultant, Lark Park, and really appreciate all your help. Thank you.
Well, thank you very much. The motion would be due pass to appropriations. And our Vice Chair Strickland has made the motion.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onnested?
Aye.
Onnested, aye. Cedillo? Cox? DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Pavley? Woke?
That bill has 4 votes. It is on call.
Thank you very much.
I know that we have 2 bills left. One is file item 12, AB 861 by Assemblyman Ruskin, and then we will have file item 15, ACR 2 by Assemblyman Hall. And I'm going to ask all our committee members to be back by 3:15, at which point we will call all the bills for a final vote. Welcome.
Good afternoon, Madam Chair, Senators. AB 861 directs the California Department of Public Health to develop simplified consolidated contracts between counties and 2 programs within the Department of Health, namely the Center for Family Health and the Center for Infectious Diseases. Consolidated contracts have the capacity to relieve unnecessary administrative burdens on local county health departments and refocus attention on quality health care. Families and children's health are not best served by the time and energy currently spent on duplicative administrative overhead. The idea I'm presenting in this bill comes from an LAO recommendation to enact legislation that would direct the CDPH to develop a model consolidated contract for public health programs. This bill is supported by local counties and health organizations and passed through the Assembly on consent. There is no opposition on file, and I respectfully ask for your aye vote. With me today is Mary Hansel, Director of Family Health Services for the San Mateo County Health System.
The bill has been moved and there's no opposition, so if we can keep that in mind, please, on the testimony. Thank you. Good afternoon.
Chair
Welcome.
And members. I am from San Mateo County, and the Centers for Family Health and Infectious Disease fund 12 important programs in San Mateo County. What we find is that the siloing of programs causes us to have a more difficulty giving a coordinated response and also adds to our administrative burden. One of our clients could easily be seen by 2 or more of the programs in the Department of Public Health. For example, Tiffany, a young parent with a baby and a diagnosis of tuberculosis, was seen by a public health nurse in the home with the Adolescent Family Life Program for her teen parenting issues, and then by a public health nurse from our tuberculosis control program. In addition, she was going to our WIC clinics. this young mom had a sick baby who stopped eating and didn't even know who to call. So at the same time, the public health nurses who were involved didn't find out that they were both seeing this mom until they'd each been traveling out 20 minutes to and from that home for some time and ran into each other there. So in addition, what we find is that on the administrative side, we really needed to build a bigger team than would otherwise be necessary. And so what this bill is looking to do is to streamline the administrative requirements, make them be more consistent across the programs so that the things that administrators who are primarily trying to do public health work have less to do in that realm, and also add to transparency of our government and really bring us to a more cost-effective state of affairs. So I ask your support. Thank you very much for your time.
Judith Regal with the County Health Executives Association. Simplified contracting procedures with the department has long been one of our goals, and we'd really like to thank the Assembly member for moving this issue forward.
Charlotte Newhart with the Directors of Public Health Nursing in the State of California and the Directors of Maternal, Child, and Adolescent Health in the counties in strong support.
Thank you.
Kelly Brooks with the California State Association of Counties. We're also in support.
Thank you. I understand there's no opposition. Comments from committee?
Do you have a motion yet?
We do. The bill has been moved by Senator Strickland. I'm sorry, was it Senator? Oh, Senator Onstead? Question? Okay. The bill has been moved by Senator Onestead. So we'll call for the vote. It would be, the motion would be due pass to appropriations.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Aye. Strickland, aye. Onestead? Aye. Onestead, aye. Cedillo? Cox? DeSagne? Leno? Aye. Leno, aye. Maldonado? Aye. Maldonado, aye. Negretti McLeod? Pavley? Woke? It's got 5.
That bill has 5 votes. It is on call.
Thank you.
Thank you very much. Our last item, members, is file item 15, HCR2, Assemblyman Hall. And then we will be opening and doing the roll on all the bills. The final vote. Welcome.
Thank you. Madam Chair, members, ACR 2 would urge the University of California to expedite negotiations with the Los Angeles County Board of Supervisors and the Charles Drew University of Medicine and Science to discuss the future management of Martin Luther King Hospital in the Watts-Willowbrook area of South Los Angeles. For over 35 years, Martin Luther King Jr. Hospital has provided trauma care services, surgery, hospitalization, and birthing services to over 1.6 million people that live and work in and around the South Los Angeles area. As many of you know, after several high-profile and extensively severe reported incidents regarding patient health and safety issues, Martin Luther King Jr. Hospital was closed in August of '07. For almost 2 years, the community of South Los Angeles has been without access to Tier 1 Trauma Center, requiring constituents to be transported 10 to 15 minutes away in order to receive trauma care services. When the difference between life and death, as you know, is counted by minutes by constituents and finding themselves on the losing side of this equation, and that is the norm in South Los Angeles. ACR 2 is an important step towards getting stakeholders engaged, getting decision makers prepared to act, and getting this hospital open in order to care for the fundamental health care needs to my constituents and the residents throughout Los Angeles area. The bill was unanimously supported in the Assembly. There's absolutely no opposition to this bill, and I respectfully ask for your aye vote. We also have Angela Gilliard with the UC system here as well. Thank you.
Yes, and that is Senator Strickland. Thank you.
My name is Angela Gilliard. I'm the Director of Legislation for Health Services and Sciences for the University of California. And we don't have a position on this bill. We, excuse me, We do believe, however, that the resolution generally embraces the approach and that the university has taken over the past years. We've worked with Los Angeles County and the Schwarzenegger administration to that would create a pathway for making Martin Luther King Hospital a vital part of the health care delivery system in South Central Los Angeles.
Is there any opposition? We do not know of any opposition. Comments from committee?
Just one question that the analysis brings up. Given that it's a three-party negotiation, is there any reason why the resolution didn't also urge, in addition to the university, also Drew and the County of Los Angeles to expedite the matter?
Well, right now, and Angela is here as well, they are already in the process of negotiating as well. I can have an amendment to encourage that as well, but they are, in fact, already in that process.
So the suggestion then of the resolution is that it's UC that is responsible for the lack of resolution at this time?
Who moved it?
I'm sorry?
That it's UC?
Yes.
Which is dragging feet?
Well, no. UC is very much actively engaged in the process right now. The resolution basically says that it encourages the UC system to work collaboratively with the Los Angeles County Board of Supervisors and Drew to help facilitate discussions to bring closure to this problem that's killing so many people in South Central Los Angeles.
Thank you for the notice. Is it a suggestion that they're not currently, UC?
Well, no, they are right now, but this is a vehicle by which more collaboration could take place. They are very, and again I stress, they are very much actively involved in discussions and conversations right now.
Okay,
yeah,
thanks.
Are there any other comments? Senator Woke.
Then why do you need this?
Well, because at the time, with all due respect, Senator, when this bill was lifted and this resolution was lifted in the Assembly, there was no discussion or no real discussion at the time. So given the fact that it passed at the time when it was necessary, we're still going through the process, and I'm presented before you, Honorable Senator.
Thank you.
Thank you.
Let's see. This has been moved by Senator Strickland. The motion would be due pass to the Appropriations Committee.
Thank you.
Senator Ahlquist?
Aye.
Ahlquist, aye. Strickland? Aye. Strickland, aye. Onnested? Aye. Onnested, aye. Cedillo? Cox? Aye. Cox, aye. DeSaulnier? Aye. DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Aye. Maldonado, aye. Negrete McLeod? Pavley? Woke? Aye. Woke, aye.
Okay. All right, members, I mentioned 15 minutes ago that we would, at 3:15, open the roll on all the bills. So this will be the final roll call. So we'll start with item 1.
I'm on everything. Thank you.
Are you? Okay.
Yes, thank you very much. SB 600 is Senator Padilla.
On the motion, due pass to Rev and Tax Committee, Senator Cox? No. Cox, no. DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Negrete McLeod? Woke? Aye. Woke, aye. It's got 6.
That vote is 6-0. That bill is out.
6-3.
Item 2, AB 108, Assemblywoman Hayashi.
On the motion, due pass is amended to Judiciary. Senator Cox? No. Cox, no. DeSaulnier? Aye. DeSaulnier, aye. Negrete McLeod? Woke? Aye. Woke, aye. 7-3.
That vote is 7-3. The bill is out. File item 3, AB 175 by Assemblywoman Galgiani.
On the motion, due pass is amended to Business and Professions Committee. Senator Cox? Aye. Cox, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Negrete McLeod? Woke? Aye. Woke, aye. It's 10-0.
10-0. That bill is out. File item 4, AB 215.
On the motion, due pass is amended to Appropriations. Senator Onnested?
No.
Onnested, no. Cox?
No.
Cox, no. Negrete McLeod? Woke? Aye. Woke, aye. 8-2.
8 to do, the bill is out. File item 5, AB 235 by Assemblywoman Hayashi.
On the motion, do pass to appropriations. Senator Cox? No. Cox, no. DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Woke? Aye. Woke, aye. 8 to 2.
That vote is 8 to 2. The bill is out. File item 6, AB 249 by Assemblywoman Carter.
On the motion, do pass to appropriations. Senator Onnested? Aye. Onnested, aye. Cox? Aye. Cox, aye. DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Woke? Aye. Woke, aye. It's 10 to 0.
That vote is 10 to 0. The bill is out. File item 7, AB 354 by Assemblyman Arambula.
On the motion, do pass to appropriations. Senator Strickland? Onnested? Aye. Onnested, aye. Cox? Aye. Cox, aye. DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Woke? Woke, aye. It's 9 to 0.
That vote is 9 to 0. The bill is out. File item 8, AB 574 by Assemblyman Hill.
On the motion, do pass to appropriations. Senator Cedillo? Cox? No. Cox, no. DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Woke? Aye. Woke, aye. 6 to 3.
That vote is 6 to 3. The bill is out. File item 9, AB 577 by Assemblywoman Lowenthal.
On the motion, do pass to appropriations. Senator Cedillo? Cox?
Number 9 is aye.
Cox, aye. DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Woke? Aye. Woke, aye. 9 to 0.
That vote is 9 to 0. The bill is out. File item 10 was put over. Yes, I mentioned it, yes. File item 11, AB 839 by Assemblyman Emerson.
On the motion, do pass to Judiciary Committee. Senator Strickland? Onnested? Cedillo? Cox? DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Woke? Woke, aye. It's got 6.
That vote is 6 to 0. The bill is out. File item 12, AB 861 by Assemblyman Ruskin.
On the motion, do pass to appropriations. Senator Cedillo? Cox?
Aye.
Cox, aye. DeSagne?
Aye.
DeSagne, aye. Negretti McLeod? Pavley? Aye. Pavley, aye. Woke? Aye. Woke, aye. 9 to 0.
That vote is 9 to 0. The bill is out. File item 13, AB 896 by Assemblywoman Galgiani.
On the motion, do pass to appropriations. Senator Onnested? No. Onnested, no. Cox? Aye. Cox, aye. DeSagne? Aye. DeSagne, aye. Negretti McLeod? Woke? Aye. Woke, aye. 9 to 1.
That vote is 9 to 1. The bill is out. File item 14, AB 1543 by the Assembly Committee on Health.
On the motion, do pass to appropriations. Senator Cedillo? Cox?
Aye.
Cox, aye. DeSagne? Aye. DeSagne, aye. Maldonado? Negretti McLeod? Pavley? Aye. Pavley, aye. Woke? Aye. Woke, aye. 8 to 0.
That vote is 8 to 0. It is out. Last item, members, file item 15, ACR 2 by Assemblyman Hall.
On the motion, be adopted to appropriations. Senator Cedillo? Negretti McLeod? Pavley? Pavley, aye.
Thank you.
9 to 0.
That vote is 9 to 0. It is out. Well, members, that is the end. Thank you for attending.
Okay, so we'll tighten up the record sheet for you.
Yeah, because I really...
Yeah.